Stop blaming your genes. Hey, this is Dr. Randall here with another one of my Friday videos. And one of the biggest misconceptions we have out there right now is that people think, oh, well, cancer runs in my family, so I'm just going to get it. Or, oh, diabetes runs in my family, and so I'm going to get it. No, that is completely wrong information. We used to think that way. We used to think that most chronic illnesses, strokes, heart disease, cancers, diabetes, dementia, Parkinson's, were genetically based. Now we're seeing it's the opposite. Flip that backwards. Depending on the disease, under 20%, sometimes much lower than that, is based on genetics. And really, it's not even the DNA as much as it is a predisposition to having something. And then your lifestyle and your diet flips that switch, and then the chronic illnesses start. I just met this lady the other day. I volunteer at my local library for book sales. And she came in with a big old glass of sweet tea that she was drinking as she was looking at books, and she happened to mention, oh yeah, my doctor said I was pre-diabetic and I'll probably get diabetes if I keep doing what I'm doing, and I'm not going to change because my mom had diabetes, my aunt had diabetes, my sister has diabetes, so I'm just going to have diabetes. It's in my, it's in my wheelhouse, so to speak, because of my genetics. And I was like, no, it's not. It's because I asked her, how many glasses of sweet tea do you drink a day? And she's like, oh, only like 3 or 4. And how many simple carbs do you consume each day? Oh, I love bread and I love desserts. And so you start seeing this picture. No, it's not your genetics, it's your diet and lifestyle. There's a great line that it's chronic illnesses run in families not because of genetics, but because of lifestyles run in families. So if you grow up eating a lot of fatty foods and seed oils and sugary desserts, then that's the norm for you. So you're going to do that into your adulthood. So it's not genetics. So please stop blaming your genes. You're worried about chronic illnesses? You have one or more chronic illnesses? Then stop blaming your genes. Start looking at your food. Number one, biggest factor at improving and reversing chronic illnesses is the food we're consuming. Change your diet, number one. And then look at other lifestyle issues. Exercise, of course, movement, sleep, community, those kinds of things. So, your fate has not been predetermined. Just because your folks had cancer, or your folks had diabetes, or your folks had heart disease, does not mean you are going to have those conditions. Almost all chronic illnesses are preventable, and many can still be reversed if caught in time. Have all these things in my book, just launched this week, the Healing Revolution Diet. By the way, thank you all for who supported the book this week, those who bought copies of the book this week. Truly grateful. I just want everyone to know the truth, to understand the truth, to know that you can prevent chronic illnesses, especially the younger generation, those of you in your 30s and 40s who are already experiencing some of these things. My heart breaks. Let's lift up this information. Let's empower everybody for better health. All right, this is Dr. Randall. Hope you enjoy your weekend. Do one thing for your health this weekend. Take care.